Welcome to Micro Health Talks, where we bring insightful discussion on all things health and wellness. When we step into a healthcare facility, we step in with a confidence and a trust. We step in with a confidence and trust that everything there is set afoot and right. Of course, the credit goes to the facility and the people who run the facility, but there is a hidden force behind all these. There's a hidden force which set the standard, which set all the discipline is right. And today we are going to talk about that force. Today we have Dr. Namita Jaggi joining with us. She's a doctor, she's a microbiologist, she's a healthcare visionary leader, and she's someone who has contributed in setting standards in healthcare globally. Dear doctor, welcome. Welcome to Micro Health Talks.
Thank
We are
you.
so privileged to have you on board.
Thank you.
I am certain the introduction that I've given doesn't do justice to what you really are. So, doctor, please take us through your journey.
Thank you. Thank you very much for that. No, I'm sure that you have been very kind in your compliments. Yes, I am privileged and honored to be a doctor. And why I say this is because doctors are blessed to be doctors, really, because they have an opportunity like none other profession where they are given the opportunity to heal people, to give them advice, to be a part of their health journey. And the kind of feedback that the patients give to them when they get okay is uncomparable to any emotion that you get. So my journey has been, it started in very much in Delhi, where after my schooling, I joined Maulana Azad Medical College and I did my undergraduation and post-graduation and residency program from there. Thereafter, I went into the private field because I wanted to really make a difference. And I have worked extensively in private hospitals. And now for the last 18 years, I am in Artemis Hospital, Gurgaon, and I look after the laboratories, I look after the infection prevention and control and research. And I can say that I thank God because it's a very good journey and a very fulfilling journey. And I also am actively participating in accreditation agencies, whether it's Joint Commission, whether it is the national accreditations. And I help people throughout the globe to follow those standards and do it in a way in which they are going to make a difference in the lives of the patient. So, upholding the good standards of patient safety and even staff safety for that matter, and making the world a better, healthier place to live in.
That's great indeed. I am quoting the word that you have told that, making the place a better one and make sure the standards are in set. So, doctor, being an auditor for past all these years, how do you see yourself? Would you like to quote something about your journey and your experiences that you have seen during this audit process globally?
Yeah. So I think that being all across the globe, I have assessed people right from the America to Middle East to the Southeast Asia to all the Asian countries, and even to the other Latin American countries. And I find that it's been a wonderful journey because not only have I been able to contribute to the learnings of the laboratory, but also I have learned a lot, and not only in the sphere of the laboratories. It's been learning the culture of the people, it's making new friends, and understanding perspectives, broadening my own perspectives, and also gradually uplifting the standards of the lab. Like I always tell the labs wherever I'm going that, please do not follow the standards just for the sake of following them. You follow them because you understand them and try to make a difference. And once you follow the standards in that vein or in that vibe, then you will, without realizing, you are making your lab, your hospital a better place. And like I was telling, somebody that audit time should not be a stressful time. Audit time should be actually a lovely time because everything gets done. You have a common goal, you have a common sense of accomplishment, and the standards are just there to help you. So, but when you take help of all these things and you work as a team, because together everyone achieves more, it's all about the team. You are leading teams to fulfill those goals, and with that journey, you make the hospital and your lab a better place. You give timely reports to the patient, you give good quality reports to the patient, and ultimately contribute to the quality and the patient safety.
quoting about what you mentioned, that the audit process is stressful. Like, of course, the people who are being audited do consider it as someone has come to find the fault. So, Dr. Like, what you love to comment on that part?
Yes, it is not fault finding. So it's not just saying these lines that it is not fault finding. When I start a survey, I always tell the people that it's a journey with you. So you are welcoming me into your fold, into your hospital, into your lab for the next 3 or 4, 5 days. You are being so transparent. You are showing me all your policies and protocols and procedures. You're taking me along, and that's a big honor for me. And of course, we maintain complete confidentiality. So I would like to say that it should not be a stressful period because it is what you are doing every day. But yes, it gives you a third eye. I always say that when a guest comes into your home, they see things which we don't see every day because we are so used to staying in our home.
Yeah.
And it is a two-way process. If somebody comes to my hospital, they will also see those things which I don't see every day. And when I am going, it's just the same. So it is learning together. It is embarking on a journey of quality and patient safety. And that is how it should be perceived. And that is how it should be experienced.
Yeah, meaning you're inducing us to consider the auditors as guests.
Absolutely, absolutely.
Yeah.
And as partners. Partners in the process of self-improvement. And this is a journey, so we can never say that we are excellent. We are always moving above, we are always pushing the envelope. We are always taking the next step. We are always pushing the bar. So I think that is where it should be. I was telling somebody that be a little dissatisfied, because if you're always very satisfied, you will not make the effort to improve. So you have this little dissatisfaction in you that it can be better. How can it be made better?
The thirst for better.
Yes, the thirst for more and more better. Yes.
So, Doctor, quality is something which is not visible, yet it is inevitable. So is laboratory. Laboratory is not upfront, it is not visible, yet it is inevitable for force or factor of healthcare. How do you correlate this both, the quality and laboratory?
Yes, so a laboratory is actually a behind the scenes thing, like you very rightly said.
Absolutely.
Right, but nowadays with this new COVID coming in, etc., people are realizing that the laboratory, infection prevention and control, or what we call laboratory physicians, we are doctors trained in medical field, but we are behind the scenes because we are laboratory physicians. There is a lot of change in their role. Now we have to move out of our labs, we have to interact with the clinicians, we have to participate in patient care. So we are equal partners. And that is the way it should be. Quality in the lab is an essential prerequisite. If we don't have good quality, we will not be able to take out good quality reports. And once we are not able to take out good quality reports, we are not able to help the patient. So it's the, quality and timeliness. These are two pillars of the efficiency of the lab. And every lab, if it wants to be efficient and make a difference, must follow good quality. That means give absolutely accurate reports in the best way possible and give the reports in the absolutely correct time. That is timeliness. The turnaround time should be, the TAT should be within the TAT always. So that is how I perceive. And I think nowadays the laboratory physicians are making a huge change. They are forging ahead. They are forming alliances. And the future is good for the laboratory physicians.
Thank you. So, Doctor, yet another question. People, of course, often think that why audit? Why auditing is so important? Everybody say about we have accredited, we have undergone this auditing, we are preparing for this audit. So, why it is very important? This is for the common people to understand the importance of audit.
So, when you come to a laboratory or a hospital and it says that it is accredited. We get a sense of assurance. The patient, if I'm a patient, I get a sense of assurance that an external body has looked at the policies, the protocols, the procedures of this lab and this hospital, and it has found it at par with the best in the world, and it has given it the seal of accreditation. So when I am as a patient visiting that lab, I'm totally relaxed and assured that everything is going on absolutely correctly. And to answer your question, why audit from the perspective of the lab? Because it is a voluntary effort. Nobody is putting it as mandatory. It is voluntary. We are going out and we are saying, please come and accredit our laboratory. I think it's very, very, because, we are so used to doing things a certain way. If we invite a guest, we will get a different perspective. we will be able to audit our own processes. We will be able to understand things that we never saw before. We'll say our eyes are open. And every time I do a survey, sometimes at the end of it, people say it was an eye opener. Why was it an eye opener? It's not rocket science. It is just that you require a different perspective. And when we have somebody external coming and telling us that, we feel that we have done it, we are good. And so we send this assurance and this confidence out to the patients, and they feel good about it.
So, Doctor, 18 years down the line in the journey, how many healthcare centers so far? And would you like to share an experience of one particular healthcare center during audit that is still striking in your mind?
No, not like this. I have almost about 30 plus years after my post graduation in microbiology.
Okay.
But yes, in this field of accreditation and Joint Commission, it's been about maybe 11 years. All organizations have been unique in their own way.
True.
Just like every individual is unique in their own way, every organization is unique in its own way. And I think the organizations, but if you have to club them, I think compliment to Qatar and a compliment to this facility, MicroHealth.
Okay.
And I also feel, a compliment to the Middle Eastern countries, really, because the Indian subcontinent, the Southeast Asian countries, the Middle Eastern countries, they are really doing very well as far as their lab standards are going. And kudos to their ministries also, because they have such stringent quality measures that they have to upkeep that thing. And all across the globe, I see good practices. So, wherever I see good practices, I share it with the other labs. So it's a kind of a global movement into good quality care of the labs. Yes, I'm very proud of it. Yes, I feel happy about it. Yes.
And we are so glad that you are contributing towards it and you are a part of it. So, Doctor, for the we consider you as a healthcare visionary or a leader who is contributing towards that. So, for the people, for the aspiring people, for us, you are a role model. So, what is a tip that you would love to give to the for the maybe budding women who would love to be in leadership in healthcare, or the people who are looking forward to pursue their career as an auditor?
Oh, that's a very sweet question. So, I don't want to make a gender bias over here, but I think I really would like to encourage all the women out there. Really, I would like to encourage, and I think it's a very good time for the women of the world. It's a wonderful time to read, to study, to come up to leadership positions. If I may say so, the men have their own very, very big advantages, but I think the women, the advantages that they have are that they have an attention to detail, and they are very conscientious, and they are very diligent. So I think these three qualities in women, I think we really need to take advantage of these three qualities and put them into leadership roles, because they will run the organizations like their own, like their own homes.
Yeah.
And we know that the women run homes very efficiently, and they run the organizations also that with a lot of compassion, with a lot of insight, with a lot of diligence, hard work. I think these all qualities are wonderful, which we have in women. So the tip that I'd like to give all the young girls is that go for it, reach the stars. Everything is possible, and don't try to restrict yourself just by thinking that we have to, look after the children at home, or we have to look up. That all you should do, and it will be done. But alongside, you have a good thriving career, because if you are contributing well to the society, to your organization, you will be a more fulfilled person. And if you are a more fulfilled person, you will be happy, and you will give back to your family. So girls, this is your time. Go for it.
Oh, that was heart touching. So I hope all the men over there would have heard of the compliments that she have mentioned about us. And dear woman, I hope you have all noted down all the tips that she have given you. So, ma'am, before we wind up, what is a one last message or a tip that you would love to give to the healthcare fraternity and to the common people who is watching us globally?
I think the healthcare fraternity is a very special fraternity. I read somewhere that sometimes the pilots who are carrying us, wearing us, and they're very important. Every profession is very, very important. But somehow we don't realize the long hours that the doctors put in, the technical staff put in, the admin staff put in into healthcare facilities just to keep us healthy. So it's time that we sit up and we really appreciate the efforts that the healthcare community does for us. And I read somewhere that if the pilots are overworked, we sort of take them off duty and we say that it's not healthy, it's not safe. But what about doctors who are doing like 18 hours duties, 24 hours duties? So have little compassion for them. They are like messengers of God, really, the healthcare fraternity. And from the fraternity itself, like I'm a part of that fraternity, we feel pride and we feel honored that God has selected us to be those messengers to spread good health in the world.
Oh, Doctor, that was indeed it was so inspiring and wonderful, and I count it as a privilege to have you on board with us.
Thank you very much.
So presenting to you the wonderful, wonderful Dr. Namita Jaggi. Thank you so much, Doctor, for
Thank
being
you.
with us, and thank you so much for the words of inspiration.
Thank you so much.
So
It was
with
a pleasure.
pleasure, Doctor. So with that note, we would love to wind up. So in conclusion, auditing is not about finding fault. Let us stress about that. Auditing is all about making sure and announcing to the world that our standards are set intact and we are following it right. That means that you can step into us with trust. And that trust is something that we make sure and we uphold and we carry forward. That is Micro Health Talks for Precious Life. Thank you.
Thank you.